All right. Hello, everyone. Thank you for joining us for our November episode of Ask the Expert. And I am here with Lion Pat Ryan from the Lexington Lions Club, and he works with the Bluegrass Lions Diabetes Project. And I'm getting a little bit of feedback, so I don't know what's going on, if that's just on my end or Lion Pat, can you hear that?
I don't hear any noise feedback.
Okay. All right. Hopefully it's just on my end. Nobody else is hearing it. So thank you, Pat, for being with us today. We are excited to talk to you about diabetes and the project that you have going on. And we're very interested in learning more, as November is Diabetic Eye Disease Awareness Month. So along with diabetes, we also want to talk about eye diseases that go hand in hand with diabetes. So thank you for being on here with us today.
Glad to be here. And November 14th is World Diabetes Day, which everything fits in here with the diabetic eye awareness and everything. And I think this is the month to be talking about diabetes and trying to fight it as much as we can.
Yeah, very good. Well, thanks for joining us. We'll dive into our questions here. So as I just said, November is Diabetic Eye Disease Awareness Month, and people with diabetes are more likely to develop blinding eye disease such as diabetic retinopathy, sometimes glaucoma, and cataracts. So you recently started the Bluegrass Lions Diabetes Project. Can you just tell us about why you started this program?
Sure. The story I normally give is that when I was real young, growing up, my grandmother came to live with us, and I noticed that she had two different size shoes. She had a size 10 on her right foot and a size 8 on her left foot. And as a small youngster, I was curious. Come to find out, she'd had all of her toes chopped off on that left foot because of diabetes. I had an uncle who later on in his life had his lower left leg chopped off because of diabetes. They both died of diabetic complications. In the year 2000, I was diagnosed with type 2 diabetes. Kept it under control pretty well, but not well enough. And when I quit my one job, I went to traveling. I spent a lot of time in the car and a lot of time sitting at the computer and not being as active as I used to be, and let myself get out of shape, and my diabetes was getting worse. So when I was finally diagnosed with stage 3 chronic kidney disease, I said, that's enough. We're going to take control here, and we're going to change things around. We're going to do something good about this. So I dropped from about well over 270. When I hit the scales and went over 270, I stopped looking. So I know I was well over 270 at one time. Wore a size 48 pant, and that was tight. I was wearing XXX shirts, and they were pretty snug. But over a period of a couple of years, I went to 160 pounds. Size 32 waist, and I was able to walk my dogs further than just down in the block. We started walking all the way around the lake and everything, and go a couple miles nowadays. So by being more active and controlling my weight and controlling what I ate, I was able to take control. And this is part of what our diabetes groups really push. They're called diabetes prevention programs to stop you from going from pre-diabetes all the way up to type 2 diabetes. And those with full-blown diabetes, we have the diabetes self-management education and support programs, which help you to manage. Because, like I said, I don't want my toes or my legs chopped off. I was able to get off all my diabetes medicine, my cholesterol medicine, my blood pressure medicine by losing all that weight and getting healthy again. And I went from stage 3 chronic kidney disease. And by the way, there's only 5 stages. Stage 3, at 4, you're on dialysis. Stage 5, you either get a kidney transplant or you die. I didn't like those options. So I'm back down to stage 1 kidney disease right now, which is, the doctor says, about normal for my age and so on. So I'm out trying to pound the drums and beat the bushes to tell folks, hey, you can do something about this. If I can do it, you can surely do it. You can control your diabetes. You can stop it from becoming, if you're pre-diabetic, you can stop it from becoming full-blown diabetes. Or if you are full-blown diabetes, you can minimize the risks of having damage, not only having your toes and legs chopped off, but going blind. Diabetes is the biggest cause of blindness in America, probably the world. But we're out trying to locate people rather than have them come into the doctor's office one at a time. We like to go to health fairs, community centers, senior centers, YMCAs, churches, any place folks can get together that we can go screen them, we'll do that. Our Bluegrass Diabetes Project utilizes 2 main things. One is the A1C blood glucose screening. And the nice thing about that is once we get that blood in the little tiny machine, it only takes 5 minutes to get your reading. And the good thing about an A1C blood glucose reading is that it doesn't make any difference what you just ate or drank, because there's not going to be a big spike in your blood glucose because of your food intake. So A1C reading gives you an average of the last 3 months, the last 90 days. And you get that in 5 minutes with our screening. And so it's good to get out to the where the people are and let them know the risks. The other thing we do at our screenings is we're able to provide a retina imaging. Jennifer, let's stop here.
Yep.
Do you need to bring up some slides from a PowerPoint presentation to show that? Share my screen?
You can. Yeah. Yeah, you're welcome to.
All right, I'm going to share screen. Got to get this fixed up here. Okay, are you seeing this?
Not yet. I still see you.
Well, show.
All right, now I see it.
There you go.
Yeah, we're good to go.
Okay. So our Bluegrass Lions Diabetes Project was able to team up with a group called IRIS, that's Intelligent Retinal Imaging Systems. And they've trained us to utilize a camera that we can take pictures of the retina. We send those pictures off to the retina specialists through IRIS. They read the images and they provide a diagnosis. So to look at the retina at the back of the eye, we have to go in through the front of the eye, through the pupil. So our camera goes right up against the eye. We look, boom, and that's what we're looking for. We want to see this optic nerve. That's a bright yellow circle on the right. That's where the nerve comes into the eyeball, and it's also where the blood vessels come into the eyeball. There's a group called the upper arcane of blood vessels that come up and around. And then there's a group of blood vessels come down, lower and around those. That's the lower arcane. And then right in the center, this dark circle area, that's the macula. And the really dark part in the center there, that's the fovea. That's your sharpest point of vision. It's where the most cone cells for sharp color vision are located. So those are the four things that we tried to get an image of, sent to the retina specialist. This is a great eyeball, looking good, okay? Now, on the left, again, a normal one, normal retina. On the right, it doesn't take a retina specialist probably to say, hey, something's not right here. Okay? That's diabetic retinopathy, where these blood vessels come along and boom, they start to leak because of too much sugar in the blood, too much glucose in the blood. That's going to block out the nerve endings that normally are your vision receptors right there. Down here, over here, over here, all these spots. So you go from this normal view of seeing your kids and grandkids, smiling faces and growing up and doing things, and you get the spots. The longer this goes on, because diabetes is a chronic disease, the more spots you get until finally nothing. We want to stop that. We want to fight blindness by catching it early. Once you catch it early, then you can do things about it. It can be treated, okay? And again, the main thing we look at are these diabetes self-management education support groups. If you're already diagnosed with diabetes, and then the DPP classes, if you're in the pre-diabetes area. Jennifer, I'm going to stop and get out of this now.
Okay.
And come on, get down out of the way. Stop the share.
All right. Well, thank you for sharing that. And thank you for the information. And thank you for your backstory on why you really started this program. And just for people out there that maybe wonder how you started this program, can you go into just a little detail about who you got involved, the Lions clubs, the diabetes groups that you work with to help kind of put this all together?
Certainly. I attended my first Lions Club International Convention in Chicago, the 100th year of Lions. And that was 2018. And that's the year that the Lions Club International adopted diabetes as one of their 5 main pillars. So when I heard that, I was just all over the people, nagging, whining, complaining, hey, where's the material? What I got to do? What kind of help you got for me? How can I get on board here? And they said, well, we just now getting started. Just give us a while. So the 2019 is a summer convention, was in Las Vegas. And I was still asking, you know, I want to get into this, what we do. And they still didn't have their act fully together, but a couple months after the convention, they sent me the application for a diabetes grant through the Lions Club International Foundation. And by that time, I was hooked into our local Fayette County Diabetes Coalition. And luckily through there, I was getting with some folks that had some expertise in grant writing, I guess, but the grant's not that tremendously hard to fill out. But we put our application together and sent it in, did a little revision. And I'll tell you this, the LCIF folks are tremendous to work with. They want you to get your money and do good things. When I was teaching, I had other grants that you didn't dot every I and cross every T, they wouldn't look at your grant. But the LCIF folks work with you all the way to help you do what you want to do. And so we got our grant funded. in, I think it was November of 2019. And we were able to get started, really get going in early. I think I may be a year off in all these dates. This COVID thing has messed my mind up.
And the Chicago was
You're off.
2017, and then
Yeah, 17, then 18, right? So in 19, we started testing.
Mm-hmm.
And we did about 30 different locations, close to 1,000 people. And it's run pretty well even, with about 34% of the folks we tested with A1C had elevated blood glucose levels, and they had no idea about it. And so part of our project is we give them resources to use, we give them information. We talk with them, again, about eating healthily and being more active and getting help from the professionals. And we also had about 15% of folks that we did retina imagings on had some type of pathology. And so those folks, unbeknownst to them, were on their way to blindness. So hopefully, we encourage them and try to follow up to see if they actually went to the eye doctor. Most of them are going to do that. Hardly anybody wants to run the risk of going blind if they can do about it.
Yeah.
In February of this year, 2020, that's when we basically shut down because of COVID. And we haven't been able to go out and do any screenings, but I do like to go around and talk about diabetes like we're doing today and make presentations to Lions clubs and other groups that want to listen. To get them to see what the risks are of having diabetes and get the help they need.
Yeah. So I'm going in our order of questions. I'm going to skip down just a few, but while we're kind of on this topic, I think what you're doing is really good just to increase awareness, because not everyone knows just how prevalent diabetes is. I mean, it's something we hear about, but we never really think about, I could have it, or, all of the things that come along with it and the consequences of having it. So in 2017, there was a study that showed that nearly 450,000 Kentuckians are living with diabetes, and I'm sure that number has probably increased.
It's over, I think it's 623,000 is the latest 20 stats.
Okay. And back in my older study, I found we were ranked 4th in the nation among the highest diabetes-related death rates. So that's not a statistic that we as Kentuckians want to be so high in. So just in your opinion, how can we best decrease this number? I think what you're doing and the Bluegrass Lions Diabetes Project is a big part of how we can decrease that, is just awareness and getting people involved and stepping into action to increase and better their own health is kind of what I think is the big answer, is just let people know that they can make a change just like you did.
If a person could just take in fact, they can't take a pill to help control their blood glucose levels, but you can't take a pill to cure diabetes. There's no cure. Once you got it, you got it. I still have it, but it's down in the pre-diabetes level. The lower you can keep your A1C numbers, the healthier you're going to stay. But if you just let those numbers go up and up and up, damage is going to be done. Again, diabetes is leading cause of blindness, also leading cause of amputations, like my family. Serious heart disease, strokes, the nerve endings, especially the little nerve endings out in your toes and legs and fingers and so on. Every place that glucose accumulates, it destroys some tissues. And once they're hurt, once those tissues are hurt, there's hardly anything you can do about it.
Right, you can't repair them.
Want to stop it before it gets bad.
Okay. So what advice would you have to someone who was recently diagnosed with diabetes?
Be sure you talk to your doctor and make sure that he or she continues to monitor at least every 6 months. If it's really bad, every 3 months, get those blood glucose levels down. May take some medication to begin with, but the other thing is getting the help you need from not the doctors or professionals, but the other professionals, which are the nurses and practitioners that offer the diabetes prevention programs and the diabetes self-management education support classes. Those are areas you go to have an intense personal group and individual monitoring and mentoring, and people are coaching you and cheering for you and working with you. They understand if you have slips and so on, but they are always there trying to help you find out how you can better manage your diabetes. Mm-hmm. There's a world of diabetic cookbooks. American Diabetes Association has theirs out. Some of the kidney folks, I used to go to that Levita kidney treatment place when I had my problems. They got great cookbooks. And it's not that you have to give up everything. I always tell them, there's no bad foods. The main thing is not only what you eat, but how much you eat of it, how often you eat it. If you want to eat pizza, eat pizza. Just don't sit down and eat the whole large pizza sitting 2-3 times a week. Have you a piece of pizza? A lot of things you can substitute. I'm drinking cashew milk now, and it's only 20 carbs for a cup, as compared to whole milk, which is I think last time I looked, 100 and some odd, 160. I eat a bread called Aunt Millie's whole bread that counts 35 a slice, as opposed to 110 for other breads, 110 or more for other breads. And it's all good. It's flavorful stuff. We just finished our Kentucky Diabetes Network annual diabetes symposium on November 6th. And I arranged for our Lickerton Lions chef, Bob Denham, to put on a cooking demonstration. Bob's a diabetic also. He showed the folks how to cook 4 great meals, and his mantra is flavor is not glucose rich. It's not carb rich. You don't have to give up flavor to eat a good meal, a good tasting meal, and also one that's good for you. Mm-hmm. So there's plenty of help out there. It's finding that help. People with diabetes and found out that, boom, I just been diagnosed with diabetes. There is a lot of places you can go for help. You're not alone. People want to help you. They want you to be successful in taking control of your life.
So basically, find your healthcare community, kind of find the people that will support and give advice and kind of be there when you slip and fall and help pick you back up and put you back on the right path. So
again, the Kentucky Diabetes Network, for those here in Kentucky, is a tremendous resource. And you can just Google Kentucky Diabetes Network and check their website out. They have all kinds of things that can help you take control of your life.
Okay. Good to share. Along with that, what advice would you give to someone who's recently been diagnosed with diabetic retinopathy? Is there anything they can do to help slow the disease? Other than just taking better care of themselves and helping with their diabetes overall.
Right. There's various stages of that, just like there's various stages of macular degeneration. When things start to go bad in the back of the eye, in the retina, if it's early on, they don't do anything usually procedurally. But if you don't take more control of your habits, get more physically active, eat more healthily, things will get worse. And that's when they go in there. They might have to put injections in. There is some other medicines they can use and try out, but it's not, doesn't, the shots don't really hurt. It sounds bad to have a needle stuck in your eye, but I'm told they don't hurt. And if you don't take control, it can only get worse. It's not going to go away on its own.
Mm-hmm.
Chronic disorder is going to keep on getting worse, sometimes faster, sometimes slower, and you're in charge.
Yeah. Are there any common complications from diabetes that people are maybe not as aware of? I mean, we've already listed nerve damage, having to get amputations, eye diseases, but is there anything else that's fairly common that people may not know about that are just complications from diabetes?
Because of nerve damage, especially in the extremity, people may slowly get more and more of a numbness in various areas, especially affects the feet. You may have small cuts and openings on your feet. If you don't examine them every time you take a shower or a bath, you may not know that those are there because you can't feel them. Those nerves are pretty much dead. And so you have to be aware that if you have a sort of a numbness or non-feeling thing going on, especially in your feet and toes, you need to get that checked out.
Mm-hmm. Yeah, because then I'm sure those, any kind of sores or cuts could lead to infection and just get worse and worse from there.
Exactly.
Okay. All right. What is the overall impact throughout Kentucky that you hope the Bluegrass Lions Diabetes Project has?
Raising awareness among lions is a big thing because most of our Lions clubs have members pretty much like me that are older. Most are male. And those two factors right there are pretty big risk factors. Being overweight, another risk factor. Having a family history is a big risk factor. So getting people aware, especially starting with Lions, try and get our Lions clubs hooked up with the various health groups, like my local Fayette County Diabetes Association. There are health associations throughout Kentucky. Trying to find my paper here. There's 15 like Kentucky regions, and they all have like a diabetes type center. Usually it's through the health department or maybe some other group. But there's a fairly localized place throughout Kentucky that people can go to for additional help. Again, the mentoring, the coaching, the being associated with others, talking through your problems and how do you face this, how do you handle that, and so on. So get the people aware of what's out there and get them the help they need.
Very good. Well, you're doing a great job at that. I know COVID has slowed things down, but hopefully we'll be able to resume life at the new normal sometime fairly soon, or as soon as it's safe to do so. I know that you'll be getting back out there and helping people become aware if they have prediabetes, or get them familiar with diabetes itself and the problems that come along with it. So we greatly appreciate the work that you're doing out there promoting it. I want to thank you for your time today talking to us about it, and look forward to working with you on this project and others with the Lions for years to come. So,
You betcha. Glad to.
all right. Well, thank you very much, Pat. We will let you go. I just appreciate you taking some time today to talk with us, and we will see you soon.
I hope everybody jumps on board with fighting diabetes and fighting blindness.
Yeah. Give us that day for the National Diabetes Day again, November.
That's Saturday, November 14th.
Okay. Are there any special things going on that you know of in Kentucky to celebrate or raise awareness or funds?
Well, again, we just had our annual diabetes symposium. Other of those 15 different areas, health areas, I think they do their own kind of things.
They'll do their own events.
A lot of Lions clubs do projects. One of the things that's been pretty traditional with Lions Club is called the Strides Walk.
Mm-hmm.
It's a money-raising walk. Could be a run, could be a walk, but a lot of folks raise money like that. There's, again, a lot of LCIF, Lions Club International Foundation, grants available for diabetes. You don't have to all have to go out there and do screenings and stick people's fingers and stuff like that. But there's things you can do for having diabetes camps. We were planning on doing a diabetes basketball camp this year. And it's all set up. And we had people coming in from all over the place, and bam, plug got pulled on that.
Yeah.
So yeah, having just get-togethers for diabetes. At our Bluegrass Fair, we always had a diabetes day for the kids and their folks to have fun and learn something while they're out there. So a lot of people do many, many different things.
Good. All right. Well, we'll wrap up with that. Thank you again, Pat, and we will see you soon.
Wonderful. Thank you, Jennifer. Appreciate it.